Hi everyone, this is Ahmed Al-Ghoul, corneal surgeon based out of Calgary, Alberta. And today I'm going to say that if you're going to do a phakic ICL treatment to correct your vision, Visian ICL is the way to go, and here's why. Okay, so you're probably wondering, what is phakic ICL? So the idea of a phakic ICL is, instead of using a contact lens, like a foldable contact lens on the eye, you're putting a foldable contact lens in the eye. So say you're someone who's got like a really large refractive error, -10, -11 or more. Traditionally, you've been to laser eye centers, they told you, sorry, you can't really have surgery. You're very frustrated by the really thick glasses that you're always wearing and can't really find good comfort with contacts, and you're wondering what else can be done for my eyes. Well, the nice thing about phakic ICL has been around for a fairly long time, and the notion of a phakic ICL is that we're putting a contact lens, not unsimilar to like a foldable contact lens you do for correcting your vision, but instead of putting it on the eye, you're putting it in the eye. So it's an additive technology because you're actually putting a lens inside the structures that are already in the eye. So let's review the structures again just briefly. So if you look at this cross section of the eyeball, you got the cornea, the front part of the eye, you got the lens, which focuses the remaining part of your vision, and you got the back of the eye. So if, for example, you're -10, doing laser treatment on the cornea for a -10 would be considered a high refractive error, and that's where it's a little riskier. You're potentially inducing risks of dry eyes, you're inducing risks of ectasia, you're inducing risks of unpredictability of how good you'll see. The beautiful thing about ICL is that essentially this foldable contact lens is inserted in front of the natural lens behind the pupil, and usually, honestly, by the next day or two, you're seeing immediate results. So I can tell you guys, it's really humbling and so gratifying to be able to take someone who's been living with poor vision for so long and to give them such immediate improvement to their vision. I've had patients literally cry as soon as they got off the bed at how clear they suddenly start seeing. It was such a awesome experience to be able to share in that joy of my patients who've been through these experiences. But that's what's really cool about the phakic ICLs. It's really great for patients who have been told previously they're not good candidates, either because the technology wasn't there or because their corneas are not suitable. And certainly we can talk a lot about who are good candidates and who are not later. All right, so let's talk about why I like the Visian ICL in particular for my phakic ICL patients. Again, the concept of an ICL is that it's a lens that you could put in the eye, and for whatever reason, either due to potential complications or patient satisfaction, you can take it out, and most of the time it creates no issues from the point of view of the patient outcome. So that's really cool, because if you think about the other options we have, we are doing lasers on the corneas, that is not a reversible option. Whereas this can truly be reversible. And with the concept of a Visian ICL, especially the Visian EVO ICL, that's where it is a reversible without having to create any real manipulation to the eye. So let me explain that in a bit more detail. So when you put an ICL in a very tight compartment space, we're talking about 3 millimeters or more, but not much more space to be able to put a lens, there's going to be a lot of things going on in that space. And one of the most important things we have to really protect is the flow of what we call the aqueous humor, which is the fluid inside the eye to be able to get out of the eye to blood vessels that take it to the rest of the body. So that action is all happening in this front part of the eye between the pupil and the cornea. And so if you're going to put a artificial lens in the eye, you're going to have to traditionally make a little hole in the blue part that you see here to allow for fluid to still keep coming through and not create problems like pressure elevation or risks like glaucoma developing in the eye. The Visian EVO ICL is a unique lens in that it has fenestrations, or little tiny holes in it, that essentially means that you don't have to do any manipulation to the colored part of the eye. You know, it's funny, the other day I had a patient who came in asking for a phakic ICL because she had a large refractive error. Her friend had it, but her friend warned her that, look, you got to be careful. There's a step that you got to be prepared for that is going to be a bit uncomfortable, which is they're going to have to make a little opening in the color part of the eye, and that part is uncomfortable. And so the way that part is done, either you do it at the time of surgery or you do it with a laser, both of which means you're doing manipulation to the eye. And I smile because I sit there, you know what, we don't do that anymore. The Visian EVO ICL essentially bypassed that whole issue altogether. And what's also really cool is now this lens corrects astigmatism. So now the opportunities to take a refractive error and correct it is much better than previously because number one, we're not having to make any manipulation to the eye. Number two, we're able to correct astigmatism. And number three, we have such large range of correction. We can go up to -20 now. That gives us a lot of opportunities to help a lot of folks out there. All right, so to summarize again, phakic ICL is a really exciting technology. It's been around for a fairly long time as well, that has been able to take patients who traditionally been told are not good candidates and now are, because of the fact that we can use a reversible lens technology, reversible in that we can put it in and take it out to correct usually higher refractive errors without having to manipulate the eye like we normally do with traditional ICL options. That's it for me. Thank you for watching.